It was at this point that Stella's vet advised her owner of the study that we're looking at and recommended the treatment. After 8 weeks of treatment, Stella's liver values were retested. The results of her treatment for an over a year-long immune-mediated idiopathic chronic hepatitis have been nothing short of amazing. If you've been in Dobermans long enough, then you know that the breed is predisposed to autoimmune issues. Autoimmune means that the body's own immune system can't tell the difference between self and non-self and ends up attacking the cells and tissues of that individual. According to a retrospective study, a novel treatment of one such autoimmune disease, immune-mediated idiopathic chronic hepatitis, or ICH, is demonstrating great results in about 80% of dogs. A viewer recently shared the outcome of her Doberman Pinscher that's undergoing this treatment. I gotta say the results will bring hope to many owners. This was my girl Piper. Although she lived to be 12 years of age, she struggled with ICH for the last 6 or 7 years of her life. Through the use of prescription diets and liver-supporting supplements and periodic blood work, I was able to kind of maintain and juggle her at a level that, while 3 times the normal range for liver values, at least allowed her to feel good and live a quality life. But this was back in the day before you could order your prescription diet food online and have it delivered the next day. In this case, I had to call the veterinarian, have them order it from their supplier, wait 2 or 3 days for it to be delivered, and then I'd have to go pick it up. Over the course of those 6 or 7 years, I screwed up a couple of times and ran out of her prescription diet and had to substitute a regular dog diet for a couple of days. When I did, her liver values would skyrocket to 6 times normal. She'd feel so sick that she couldn't eat, and for a girl that liked to eat, that was saying something. I wish that the possible treatment that I'll be sharing with you in this video had been available back then. Had it been effective for her ICH, it could have saved Piper needless discomfort and me years and years of worry. To understand idiopathic chronic hepatitis, we have to first look at what the liver does and then the Doberman breed's other liver dysfunctions. In a healthy dog, the liver directly or indirectly affects every cell and process in the body. It's estimated that this largest internal organ of the body performs over 500 chemical functions that are absolutely vital for the continuation of life. Besides a few of the functions that you see here, the liver metabolizes and filters the blood. It produces components like proteins and digestive enzymes and bile for digestion. It stores iron and copper, releasing them as needed and eliminating excess in the bile. And the liver produces vital blood clotting factors. The most notable liver dysfunctions in Dobermans include copper-associated hepatopathy, which occurs when an excess accumulation of copper is stored in the liver, leading to toxic levels. Dogs with this disease unfortunately have an average survival time of only 18 months. Benign or malignant cancers. Toxins such as the sugar substitute xylitol, some blue-green algae as is found in contaminated ponds, sago palm plants, or it can be drug-induced. And there's always viral, fungal, and bacterial infections. If those previous liver dysfunctions are not responsive to diet changes, liver-protecting supplements, or drug therapy, and can be ruled out with blood work and liver biopsy, then idiopathic chronic hepatitis is the fallback diagnosis. Idiopathic means that the cause is unknown, and in Dobermans it's believed that this hepatitis of an unknown origin is likely due to an autoimmune response. Dogs with hepatitis can fly under the radar with no outward symptoms that you see for an average of a year and a half. When they do begin showing symptoms, they can include yellowing of the eye whites and gums, lack of appetite, vomiting, weight loss, increased drinking and urination, fluid retention in the abdomen, blood clotting issues, and seizures. Unfortunately, by the time clinical signs do appear, up to 75% of the liver is already damaged. That's why an annual visit with your veterinarian for a physical exam along with blood work is so important. Upticks in liver function, most notably ALT and ALP, can be an early indicator of liver damage. As with most diseases, the earlier a disease process can be noted, the better chance you have of managing it. That management typically consists of supplements that are protective of the liver function, like SAMe, vitamin E, and milk thistle, antibiotics, prescription medications, prescription diets. But if those treatments don't yield results, then the corticosteroid prednisone is often tried in an attempt to suppress the immune system's attack on the liver. However, corticosteroids can cause substantial adverse effects and can't be used in patients with cardiac disease, which includes a large portion of the Doberman population. In 2019, a retrospective study was published which analyzed the potential use of cyclosporine as a treatment option for idiopathic chronic hepatitis. Cyclosporine is a biologic drug that moderates the immune system without the severe adverse effects found in corticosteroids. In the study, 48 dog cases were reviewed which had been ruled out for other liver diseases. While some of these dogs did have high liver copper values, their other testing did not support a diagnosis of copper-associated chronic hepatopathy. In a median time of 2.5 months, 38 of the 48 dogs attained biochemical remission of ALT values during the treatment with cyclosporine. One of my viewers recently gave me access to her records for her 7-year-old Doberman, Stella, who has a history of increasing ALT and ALP levels despite being on SAMe and milk thistle. In this graph, Stella's actual ALT levels are represented in green, while the normal range is in yellow, and Stella's actual ALP level is represented in purple with its normal range in blue. In February, we see that Stella's ALT is about double the normal range, while ALP is comfortably within the normal range. 7 months later, her ALT value has vaulted to almost 8 times its normal range, and ALP, while still in the normal range, has increased nearly 50%. The following March, we see that Stella's ALT has skyrocketed to over 10 times the normal range, and ALP is more than double the normal range. It was at this point that Stella's vet advised her owner of the study that we're looking at and recommended the treatment. To be effective, cyclosporine must be absorbed through the intestines. A coating is applied to the capsule to make it impervious to stomach acids so the capsule will pass through the stomach and arrive in the intestines intact. Unfortunately, this same coating caused GI upset like lack of appetite, vomiting, and diarrhea in about 38% of the study dogs. 88% of those dogs improved when they decreased the dosage, adjusting it how often it was given, or by freezing the capsules first. Like those study dogs, Stella also had GI side effects from her initial dosage. After about 2 weeks of playing around with the dosing, Stella was able to tolerate the treatment by dropping her to once daily dosing and giving a frozen capsule 2 hours after a meal inside of a small treat. After demonstrating that she could tolerate this new dosing protocol for almost 3 weeks, she was then bumped back up to twice daily dosing for an additional 3 weeks. After 8 weeks of treatment, Stella's liver values were retested. The results of her treatment for an over a year-long immune-mediated idiopathic chronic hepatitis have been nothing short of amazing. Her ALT dropped from a high of 1,360 just weeks before to a normal of 118, while ALP settled back down well into the normal range. With this remission, Stella is now on 1 capsule every 3 days and will be retested in a month. Stella's mom has promised to share those results with me, and I will further share them at the top of the video comments along with any other notes of interest. An important note is that Stella's veterinarian said that according to a recent talk that he had attended, the brand name Atopica works much better than the generic cyclosporine. Unfortunately, Atopica is pricey in its oral form. For those of you with health insurance for your dog, you're likely going to find that they're not going to pay for Atopica because prescribing it for ICH is an off-label use. However, Stella's insurance finally did agree to pay for her treatment after her veterinarian wrote a letter to the insurance company. It's also important to note that further studies, including clinical trials with a control group, are needed to establish the long-term efficacy, optimal dosing, and any potential long-term side effects of cyclosporine treatment. But until that time, it may be a worthwhile treatment option for Dobermans with idiopathic chronic hepatitis, including those with elevated copper levels that have had copper-associated hepatopathy ruled out by liver biopsy. If you suspect that your Doberman may be suffering from chronic hepatitis or any other health condition, consult your veterinarian for a proper diagnosis and treatment options. Take a bow. Good job.